Okay, we're here with Alicia, and we're going to do an evaluation, quick history, and run through an evaluation for her right lateral knee pain. Okay, Alicia, tell me, what do you do for a living?
I'm a speech pathologist.
A speech pathologist, and where, what sort of setting do you work in?
Long-term care.
Long-term care. So you're sitting more, standing more, running around more? What's a typical day like?
Standing, running around. I sit with patients, but not. I'm up and down.
Okay. Okay. And do you work full-time or part-time?
Part-time.
Part-time. Okay. And when you're not at work, what do you do for fun and for exercise?
I run several times a week, and I'm pretty active. I hike and walk around. I mean, nothing crazy.
Yep. And several times a week you're running. How much running do you do? Is it every day? And what's your mileage like?
I typically run 6 miles a week, maybe moving my body 9 miles. I walk, 3 to 6 miles a week as well. So 2 days running, 2 days walk running. Yeah, it's intermittent and consistent, but not consistently running.
Okay. And so tell me a little bit about your knee pain and what's going on.
After a mile and a half or so, certainly 2 miles, I start getting knee, like burning through the outside of my knee, right, kind of even with my kneecap and then up above a couple of inches, and it just burns.
Okay. And when did this burning knee pain start while running? Or when did you start feeling it? When's the first time you felt it?
Years ago, so it's been kind of a chronic issue for me that kind of comes and goes throughout my spurts and spats of running.
Okay. Is it currently preventing you from running, or are you able to run now?
I am currently running now, and I think when I increase my mileage, that's when it kind of starts to hurt.
Okay.
More.
So overall, would you say your condition is changing? Are things getting better? Are things getting worse? Or they're kind of about the same, this chronic knee problem that kind of comes and goes and comes and goes?
It is probably getting better, I think. The more I stretch, I think the better it feels.
Okay. Very good. Good. Okay, so a quick pause here. I always ask my patients, I sit them on the table, number one, I ask them what they do for a living. It kind of just sets them at ease and it doesn't just dive right into their problem. And I'm also getting a sense of, does Alicia's knee pain bother her work, or is there a work-related thing related to this knee pain? It doesn't seem like it here. And we get a sense of what does she do for activity and exercise. And it seems like this running, and she even offered when this increased mileage occurs, she gets some knee pain. So that's why I asked those questions there. Okay, so it's been a long-going problem here, and it's episodic. So I guess the question is, do you feel symptoms all the time, or do they come and go?
No, as soon as I stop running, they go away.
Okay. So, and that's really typical for people with lateral knee pain and iliotibial band problems is that it hurts when you run, and then as soon as you stop, it goes away. Are there other activities besides running that make you feel your lateral knee pain?
No.
No. Climbing upstairs, no problem?
No problem.
If
Climbing upstairs,
okay. Skiing, hiking,
elliptical.
You can do all those things. It's just running.
Just running.
And if you've been sitting for a long period of time and you go to rise up, is there any difficulty rising up or pain with rising up?
Not that I've ever noticed.
Okay, good. And I ask that question because very often people with knee arthritis, after they've been sitting with their knee bent for a period of time, have a difficult time rising up, especially people who are in their 40s and middle age. But anyway, so this doesn't sound like knee arthritis. It sounds just like iliotibial band symptoms. Yeah. And so as soon as you stop running, things seem to get better?
Yes.
Okay. Good. Do you do anything else for this problem? You mentioned some stretching that you do. What do you do?
I stretch my hamstrings, my IT band by leaning up against the wall and kind of pushing my hip out.
Sideways? Yep.
And that's about it.
Okay. And are there other strengthening exercises that you do for your iliotibial band?
Consistently, no, but I have done some leg raises in the past. I've visited physical therapists before.
Oh, physical therapist. And so do you still do those leg raises or no?
I have not.
Okay, very good.
I've also tried some kinesiotaping in the past, years and years ago. Okay. Which
did that have an effect on things?
It may have helped it a little bit, but it was a quick fix.
Right.
Yeah.
And here we are. Right. Okay. All right, and have you had any other treatment for this, like chiropractic care, other physical therapy, massage, other things like that?
Not really, no.
No. Okay, good. And with this knee problem, you're a healthy person otherwise, right?
Yes,
Do you have any back pain that you associate with your knee pain?
I have back pain, not that I associate with my knee pain, but that doesn't mean that they're not related.
Okay, but you don't, do you relate them, like when my back hurts worse, my knee hurts worse, or
No.
not necessarily?
No.
Okay, just ruling out any sort of lumbar spine problem or anything like that. Any recent surgeries, accidents?
No.
No. Any unexplained weight loss or weakness in your leg or anything to think that this is something else other than iliotibial band problems or lateral knee pain?
No.
Right, just ruling out any yellow flags or red flags here that we should just stop, and it doesn't seem like we should. Okay, and my favorite question to ask after an evaluation or after a history taking is there anything else about your lateral knee pain that we've missed or forgotten?
Not that I can think of.
Right. Okay, so we've gotten a quick history there, and it was pretty simple, right? What does Alicia do for a living? What does she do for fun? What happened? What's going on here, right? And we really focused in on the lateral knee pain. I try to control the eval when I'm asking questions. I don't let the patient run off with all sorts of different things. If they need to tell me some things, I give them the opportunity, but I try to stay focused. Like, here's our problem. Hurts when I run, it's better when I rest. I've tried some stretching, some taping, went to a PT in the past, did a few leg raises and things like that. But here we are. And then of course, should we proceed? Yeah, there's no reason that there's any red flags or anything, any reason why we can't proceed. Okay, so let's take a look at a few different things. I usually explain to the patient what I'm going to do, and so I'll do that now. We're going to just poke around your knee a little bit. I want to see how it's moving in different directions. We're going to see how strong some of these muscles are, and we might do some functional things to see the position of your knee as you move around. And that will sort of guide us and tell us what do we need to do to start to take care of this problem. Okay?
Sounds good.
Okay.